Yeah.
So Tapuia, Katrina, Marlene, why was it important for you to get the vaccine?
Because there's been so much publicity about the vaccine, I thought it would be a big process, but actually it was no different to getting the influenza vaccine. Did you find it was an easy process?
Yeah, so when I turned up, there was a health worker and he gave me the consent form and taught me through the paperwork.
So then that paperwork was handed over to the nurse. She ran through a checklist of previous immunisations. Ka kōrero tēnei he kia he hanga āhuatanga I pāna ki tēnei rongo a ārai mate.
And then she asked me what arm I wanted it in, and I'm right-handed, so I got it in my left arm.
So they gave a sticker that wrote the time that I got the immunisation. And so when I went to the observation area, they knew when my time had started.
It was actually good just sitting there and being able to talk to other people about their experience as well.
Straightforward, very clear, an easy thing to do.
Did you get any side effects?
I did. I got a really sore arm. It was mainly just around my shoulder, exactly where the injection was. That happened for about a day and a half.
Yeah, so I was the same. I had a sore arm and I kept moaning about it, and finally my partner said, have you taken some Panadol? So I took some Panadol and the pain went away. So, yes. What do you think we need to do to support our whānau make the decision to have the vaccine?
Each community has its own way of receiving messages, and I think that we need to work hard at tailoring that.
The two words that come to mind for me are the flexibility and the whakawhanaungatanga, that the more that this can be done by people who already are trusted in the community and are known to the whānau that are receiving the vaccine, the less stressful this whole situation is going to be for whānau.
Haere atu ki ngā tākuta ki ngā ngehi ki ngā kaimahi haura, kai a rātou te mōhiotanga. If you have questions, ask them.
People need to get as well informed as they can. It's almost like you can't afford to sit on the fence with this one. Be decided about that and make sure that you're connecting with websites, with social media, where it's official information coming through.
Katrina, why do you feel like it's important to get vaccinated?
For me, this is one of the biggest things around opening up our borders to Australia and to the Pacific Islands in particular. Lots of us have got whānau there, and I think this is the main mechanism in which we'll be able to do that.
I live in a house of 3 generations, so for me it's important as a grandmother. I want our household to be safe.
2 main people in my life at the moment that I really wanted to sort of look after. Oh my gosh, getting a bit emotional. I've just had a baby. Hopefully the nutrients that I can give him and the antibodies that I can give him through having the vaccine myself get to him and get his immunity a little bit stronger. But also my nanny, she's got a long-term respiratory condition. Although she's well currently, she's got really low reserve. So if she was to get COVID-19, I don't know how quickly she'd bounce back. And working as a doctor in South Auckland, we're quite high risk and we're a COVID testing station as well. So the likelihood that we're taking it home to our whānau is quite a lot higher. I wouldn't want anything to happen to them. That's my one.
Ka pai.
Golly, that was a trigger, wasn't it?
Thank you for coming along today to talk to us about having the COVID vaccine.
Thank you, Lily. Thanks for the opportunity.
Ngā mihi.
Cheers.